Welcome back to the deep dive, where we really get into the details hidden in the sources you share with us. Today, we're tackling a topic that sounds, well, pretty specific at first, Potomac Horse Fever. But, as we're going to find out, that name, it's actually quite misleading. It hints at something much bigger, much more complex biologically.
It really does.
So our mission today, using the articles and research you sent over, is to basically pull out the key insights, get you up to speed quickly and hopefully engagingly.
Exactly. For this deep dive, our aim is to dissect this really interesting and pretty serious equine disease. PHF, as lots of listeners probably know it.
Right, THF.
We'll look at everything from its, frankly, bizarre life cycle, which is a whole story in itself, right through to the really critical stuff like treatment and, importantly, prevention. And understanding something like PHF, I think it gives you some really valuable insights into how incredibly interconnected biological systems are. It's like a small window into, larger ecological health.
Okay, so let's start with the basics for anyone who isn't familiar. What is Potomac Horse Fever? Because, like I said, that name really does make it sound geographically stuck.
You're right. The name is definitely deceptive. It's an acute infectious disease in horses, potentially fatal. And it's found way beyond the Potomac River. We see it across North America, parts of Europe, South America, even India.
Wow, okay. So global then. And what's the bug responsible?
The bacterial culprit is Neorickettsia risticii, although if you're looking at older studies, you might see it called Ehrlichia risticii. Same thing, just an older name.
Gotcha. And what does it actually do to the horse? What's its main effect?
Its primary target, its main effect, is something vets call enterotyphloculitis.
Okay, that's a mouthful.
It is. Basically, think of it as really widespread, severe inflammation deep inside the horse's gut. We're talking the small intestine, the cecum, the large colon.
So the whole digestive powerhouse, really.
Pretty much.
Yeah.
It's a major disruption. And what's interesting is we don't fully understand exactly how it causes all the damage, the pathophysiology. But we know N. risticii is an obligate intracellular bacterium. Meaning it has to live inside other cells to survive. It essentially hijacks them. It particularly likes certain immune cells, monocytes in the blood, macrophages in the tissues, especially in those gut areas that get inflamed.
Okay.
And here's something maybe surprising. It seems like the majority of infections are actually mild or even subclinical.
Subclinical meaning no obvious signs.
Exactly. Or very subtle ones. You might even find evidence of colitis, inflammation in the colon, in mild cases where the horse never even develops diarrhea.
So a stealthy gut invader found worldwide. But now, this is where, like you said, it gets really weird. The transmission. You described it like a thriller. Bacteria, worms, snails, insects. Walk us through that. It sounds completely wild.
It is. It's remarkably complex, so many steps. It involves multiple hosts for Neorickettsia risticii. It actually starts with the bacterium living inside another organism. It's an endosymbiont inside parasitic flatworms. Flukes.
Flukes. Okay, so a parasite inside another creature, that's already complex.
Right. Then the fluke eggs containing the bacteria get eaten by aquatic snails.
Snails now. Okay.
Yeah. Inside the snail, larval stages of the fluke develop. They're called cercariae. These cercariae then emerge from the snail, swim around, and invade a second intermediate host.
A second one. Next.
This is where the insects come in. The larval or nymph stages of aquatic insects like caddisflies, mayflies, damselflies, dragonflies, stoneflies, those guys.
Wow! Bacteria to fluke to snail to aquatic insect larvae. So where do the horses fit into this chain?
This is the critical step for horses. They get infected when they accidentally eat these infected aquatic insects.
Just eat them? How does that happen?
Well, think about it. The insects might hatch near water, then maybe fly towards light, fall into water troughs, or land on hay or feed. Or horses grazing near ponds or streams might just ingest them directly with the grass. And here's a really key detail for horse owners. These infected adult insects, they're attracted to barn lights at night.
No way.
Yeah, so they fly to the lights, die, fall down, maybe right into the horse's feed bin or water bucket. Makes it really easy for the horse to ingest them.
That's incredible. The barn light is like a trap, drawing the disease vector right to the horse. So if one horse gets it, can it spread to others in the barn, like a cold?
No, and that's really crucial. Horse-to-horse transmission isn't considered a significant factor at all. The horse is basically a dead-end host for the bacteria in terms of spreading it further that way.
Okay, that's good to know.
And this whole complex, environmentally driven cycle explains the seasonality too, right?
Makes sense.
Most cases pop up in warmer months, late spring, summer, early fall. That's when the snails are active, the insects are hatching and flying around.
And near water, presumably.
Exactly. It's strongly linked to pastures, the border rivers, creeks, ponds, freshwater sources, where this whole cycle is playing out.
It's just amazing. So many different players needed for this one bacteria to infect a horse. Really makes you think about those hidden connections in nature.
Absolutely.
So, okay, given this complicated path, what should horse owners actually be looking for? What are the signs if their horse does get infected?
Well, the incubation period time from exposure to seeing signs is usually about 1 to 3 weeks.
Okay.
And the signs themselves, they can vary a lot. From those mild or subclinical cases we mentioned, all the way to really life-threatening illness.
But it's usually first.
Often, the very first sign is a fever. Could be anywhere from, say, 102 Fahrenheit up to maybe 107. And it might be transient, like it spikes and then drops, or it might cycle up and down. So you could miss it if you're not checking regularly.
Right, easy to miss.
Then you'll usually see the more general stuff, depression, lethargy, just not acting right,
Yeah.
and going off their feet, anorexia.
And since we know it hammers the gut, what about specific digestive signs?
Yeah, absolutely key. One of the most consistent findings is something called ileus.
Ileus, meaning the gut slows down.
Exactly. The normal movement just stops or slows way down.
Mm-hmm.
So listening with a stethoscope, you'd hear decreased gut sounds, or maybe none at all. That's a really common, significant clue.
Okay, and diarrhea.
Diarrhea develops in maybe 60% of cases. It can be anything from just soft manure like cow patties to really watery, explosive projectile diarrhea.
But not always.
But not always. That's the tricky part. About 40% might not have diarrhea, which can really throw you off diagnostically.
Yeah, I can see that.
You might also see mild colic signs and definitely signs of dehydration, tacky gums, skin tinting, increased heart rate.
And you hear horror stories about laminitis with PHF? How big a risk is that?
It's a huge risk. Very serious, very common complication.
Mm-hmm.
Happens in maybe 20 to 30% of cases.
That high. Wow.
Yeah. And often it affects all 4 feet, which is bad. It can be incredibly severe, really painful, and frustratingly difficult to treat. Sometimes it gets worse, even when the other signs are improving.
Uh-huh.
And tragically, it can lead to permanent lameness. Or sometimes euthanasia is the only humane option.
That's just awful. Are there other major worries, like for pregnant mares?
Yes, definitely. Abortion is a known risk for pregnant mares, usually happens about 2 to 3 months after the initial infection. The bacteria can cross the placenta and infect the fetus.
Oh, terrible.
You can also sometimes see edema, like swelling in the legs, and changes in their blood work. Typically, the white blood cell count drops early on, then shoots up as the immune system fights back. And electrolyte imbalances are pretty common too, from the gut issues and fluid loss.
So with all these variable signs and the chance it could be mild or mimic other things, diagnosing it sounds tough. How do vets actually pin it down?
It is a challenge. It usually starts with what we call a presumptive diagnosis. Based on the signs you see, the time of year where the horse lives, is it near water, that kind of thing.
Right. History and context.
Exactly. But to be sure, you really need lab testing, especially because, like you said, the signs, fever, diarrhea, lethargy, can look a lot like other serious gut problems like salmonella or C. diff.
So what's the gold standard test?
The most common, and generally the most reliable for confirming an active infection, is PCR, polymerase chain reaction.
Okay. What does that detect?
It detects the actual DNA of the N. risticii bacteria. You can run it on a blood sample or sometimes a fecal sample.
What about antibody tests? Blood tests looking for exposure?
Yeah, serology. It looks for antibodies the horse's immune system made against the bacteria.
Mm-hmm.
But it has limited value for diagnosing an acute current illness.
Why is that?
Well, a positive result could just mean the horse was exposed months or years ago, or maybe it was vaccinated. The antibodies stick around.
I see.
And sometimes, in the early stages of the illness, the antibody levels haven't risen enough yet to be detected. So a single test isn't super helpful right then.
So what is helpful with antibody tests?
What's more informative is if you take 2 samples, maybe 1 to 2 weeks apart, an acute sample early on, and a convalescent sample later. If you see a significant rise in the antibody level between those 2 samples, that's much stronger evidence of a recent active infection.
Paired samples. Makes sense.
Yeah. And regular blood work, checking cell counts and electrolytes, that doesn't diagnose PHF specifically, but it helps assess the horse's overall condition and guide supportive care.
Okay, so let's say you've got a diagnosis or a really strong suspicion. What's the treatment plan? And thinking ahead, how can you even try to prevent this whole crazy cycle from getting to your horse?
Right. Treatment first. Early diagnosis and getting started with aggressive treatment, that's absolutely key for a good outcome.
What's the main weapon?
The drug of choice is an antibiotic called oxytetracycline, usually given intravenously. And it works fast. You often see noticeable clinical improvement within just 12 to 24 hours.
That's pretty quick.
It is. But honestly, the antibiotic is only part of the story. Supportive care is absolutely paramount. Often it's the supportive care that really determines whether the horse pulls through.
Meaning fluids and...
Exactly. Lots of IV fluids to combat the dehydration and correct electrolyte imbalances caused by the diarrhea or lack of intake. And NSAIDs, non-steroidal anti-inflammatory drugs like flunixin miglumin, Benamine is a common brand name, that helps bring down the fever, reduce pain, and fight that inflammation in the gut.
And what about preventing that laminitis you mentioned? Can you do anything during treatment?
Yes, absolutely critical. Prophylactic cryotherapy. That just means preventative cold therapy.
Icing the feet.
Yep. Icing the feet and lower limbs continuously, starting right away as soon as BHF is suspected or diagnosed. It's strongly recommended for all cases to try and head off laminitis before it starts or gets bad.
Good tip.
And also, just good practice, isolate the horse initially, at least until you've ruled out other contagious causes of diarrhea, like salmonella, just to be safe.
Okay, that covers treatment. Now, prevention. Is there a vaccine?
There is, yes. A killed vaccine is available. Now, it's not perfect. It might not completely prevent infection in every single horse.
But it helps?
But the evidence suggests it can significantly lessen how severe the clinical signs are if a horse does get infected, which can definitely improve the prognosis.
Okay.
However, there's a catch. Research, particularly in areas where PHF is common, has shown pretty high rates of what they call vaccination failure, maybe up to 89% in some studies.
Wow, 89% failure. Why so high?
It's thought to be mainly due to strain variability. There seem to be different strains of N. risticii out there, and the vaccine might not provide good cross-protection against all of them.
Ah, okay, so it might protect against some but not others.
Potentially, yeah. But despite those numbers, you hear a lot of anecdotal reports from vets and owners that vaccinated horses just seem to get less sick if they do catch it. So vaccination is still generally recommended, especially in endemic areas, and particularly for pregnant mares. Usually timed to be boosted before the main insect season hits.
Right. So besides vaccination, what about managing the environment? Hitting that weird transmission cycle.
That's hugely important. Environmental management is key because it targets how the horse gets exposed in the first place.
Like keeping them away from water.
That's a big one. If possible, limiting access to creeks, ponds, rivers by fencing them off, especially during the high-risk summer and fall months.
And the barn lights.
Yes. Minimizing nighttime lighting around barns and pastures. Remember, those insects are drawn to light. Turning off unnecessary lights can really reduce the number of insects potentially falling into feed and water.
Simple but makes sense.
Also, just basic hygiene. Cleaning water troughs frequently, keeping feed bins covered, especially overnight. Simple steps, but they reduce the chance of insects contaminating them.
And just keeping a close eye out during those risky months.
Absolutely. Vigilant monitoring for any early signs: fever, lethargy during late spring, summer, early fall. Early detection makes a huge difference. It really shows how sometimes the best defense isn't just medicine, but being smart about the environment.
Okay, so putting it all together, after all that, what's the general outlook, the prognosis for a horse with PHF?
Well, the mortality rate, unfortunately, can range from about 5% up to 30%.
So potentially quite serious.
Definitely. Severe cases, especially those with really bad diarrhea that doesn't respond well, or severe laminitis,
Yeah.
they have a poorer prognosis.
But on the positive side.
On the positive side, horses that do recover usually develop pretty good immunity. It can last for up to about 2 years. And importantly, they don't become chronic carriers, spreading it around later. And if you catch it early and treat aggressively, especially the milder cases, recovery can be quite quick, maybe just 3 to 5 days, which again just underscores why acting fast is so critical.
This has been absolutely fascinating. I mean, really eye-opening. A journey from bacteria inside tiny flukes through snails into mayflies, buzzing around a barn light, all to affect a horse. It's just, wow. It really drives home how intricate these natural systems are and how vital it is to understand them, not just for horses, but for, well, for everything.
It really does. And it leaves you thinking, doesn't it? When you consider all those complex, almost improbable connections needed for a disease like Potomac Horse Fever to even happen, the bacteria, the fluke, the snail, the insects, the horse. What does that tell us about all the other hidden ecological webs out there? The ones influencing health, maybe our health too, in ways we haven't even begun to map. What other surprising sort of invisible connections might we be overlooking right now in our own backyards, our own environments?
That is a really powerful thought to end on, something to definitely chew on. Thank you so much for walking us through that complexity. And thank you for sharing your sources and joining us for this deep dive. Stay curious, keep asking questions, and we'll catch you next time.